A lot of patients have questions about neck lifts. So neck lifts are a very common procedure that I do. We commonly do that in conjunction with a deep plane mini lift or a deep plane lower face lift. On occasion, we will do a neck lift on its own. Typically, that's for people who only have neck problems, as you can imagine, and they don't have significant jowling. And usually those are people who have sort of the family neck, sort of develops a little bit earlier than they would hope, and we can just do a neck lift in that situation. Nobody likes the neck that looks old. People are okay with some crow's feet, people are okay with some lines around the eyes, but nobody likes their neck looking old. So what contributes to the neck looking old? Well, usually it's a combination of extra skin that might be a little bit sun damaged and wrinkly. There might be some fullness in the neck that's developed over time. And then there might be these vertical bands. We call them turkey bands. So those bands are the front edges of two sheets of muscle called the platysma muscles. There's one on each side. And they're very thin sheets of muscle. And over time, they tend to separate and they sort of fall forward. So that's why we start to see these vertical bands. So when we do the neck lift, we make a small incision under the chin, and then there's a short incision in front of the earlobe that continues on the back of the ear, in the crease next to your head, and into the hairline. So once those heal, it's extremely difficult to see. It's super discreet. But through this incision, I'm able to lift up the skin down to sort of the lowest line. In those patients who have some extra fat, I will remove that surgically. So it's not just a random liposuction. I like to surgically sculpt that. And I also like to leave a little bit of fat on the undersurface of the skin. Because if you take out too much fat, like when they do liposuction, it looks almost skeletonized, and it afterwards looks like you've had some type of surgery on your neck, when in fact you want it to look very natural and what I like to call sort of a supple neck. So that suppleness is a very attractive neck. So it's important to leave a little layer of fat on the undersurface of the skin. But after removing the extra fat, then I'll see those two muscle sheets and that separation of the front edges. And what we do is we bring those bands back together with a series of stitches, and when those are tightened, it's like a corset. So they call it a corset platysmoplasty. This is sort of the gold standard neck rejuvenation technique. And then we do a couple extra things to make that look even better. So just below where the lowest suture is, we'll actually cut the band to make the lower bands look less prominent. And you don't need that muscle to move your neck or anything like that. And then on the back edge of the platysma, we'll lift up underneath, and then we'll pull the back edge back and secure that to the tissue behind your ears. So we've brought it together in the middle like a corset. We've cut the bands below that, and then we pull back and secure that to the tissue behind your ears, and that gives you your best neck angle. So the focus is on the muscle layer and not just pulling the skin. Now there is extra skin that we need to remove, and we do that from behind the ears, not under the chin, because it would bunch up underneath here. So we're able to tailor that nicely behind the ears so that you can't see it.